I will show you what are the minimum aseptic precautions you have to follow for the disc procedures where you can avoid the infection in the disc. Infection may happen anytime, but we can follow these minimum steps which will definitely help you to do regularly disc procedure. Okay, so first I have taken the patient. I will do first painting without preparing anything. I will do painting. So, I take betadine and solution scrub. So before preparing anything, I will just clean. So I will do here L45, L5S1. So first I just put the betadine scrub, then sterilium system. So after putting the paint there, then I will prepare my setup so that I can get little more time to keep this betadine solution and scrub, which will give better protection on the skin. Now take the syringe. Now I will spend time preparing all the tray, taking syringes, needles. So these things will help you to keep the aseptic solution on the skin little more time to give better aseptic film. Five ml, 10 ml, 3 ml, 5 ml. Okay. Now 18 gauge needle. So as here I am doing for L4, 5, L5 or some, I have taken two 18 gauge needle as I am doing two disc procedure. So this will be for double needle technique. I am taking 26 gauge 1.5 inch needle for giving local infiltration. I am taking local anesthesia, Xylocard. Usually always I make it 1%, 1% Xylocard. Now dye and simply extension tool. I have taken dye for transfemoral epidural, 10 cm extension tool. And I'm in Canacort. It's going to be different something like that. This is now in 2 ml Canacort. I will do intradiscal local anesthesia steroid because there is a tear in the disc, so discogenic pain. I am not mixing any normal saline, so I will take 1.5 inch needle. This long needle. can bend now with my finger. I will show you afterwards. So now everything is ready with local anesthesia, dye, steroids with local anesthesia, and your needles with 2 18 gauge needle for. So now this much time you have spent for preparation of the trolley, and you have kept the solution there. Now I will clean it with sterilium. So this extra time will help you to get a better aseptic fully prepared skin. Again I will clean my hand as far as possible. Now 1% xylocaine 10 ml with 1.5 inch hypodermic needle. I will go for first L45 height increase. This is how I am doing interdiscal procedures through Camille strangle. I have taken the entry point. I am giving a local anesthesia. छोटा सुई लगेगा. थोड़ा सहन करो. नहीं तू हाँ यहाँ में. So I have infiltrated local anesthesia. I am taking sterilium, and so after giving this infiltration, I am again cleaning this area with and putting a swab of sterilium, so that even after giving so much time for betadine solution scrub cleaning, again after giving local anesthesia, again I am cleaning this area with the sterilium. Okay, and keep it like this. Now I will take 18 gauge needle. I will put it here at the entry point, so I can see, shoot. So now needle entry point is correct. Now I will take a needle. I will not touch the tip. So I always do opposite the bevel. You can see the point here. So that is a bevel. I will take a sterile and I will bend it with the, not with my finger, I am bending it with the sterile swab. So as much as possible I am following the aseptic precautions without touching the tip, using the double needle technique. Now I will go inside. Okay. Yes, shoot. I will try to hit the superiorarticular process. I am hitting the superiorarticular process. Shoot. And now I will turn the needle and go inside the disc. Again, going more medially. I have gone inside the disc. Shoot. Okay, AP view. Take lateral view, dorsal view. In this way, we can follow the disc procedures to avoid the infection in the disc. So now I am taking out the needle lateral view shoot. So now you can see needle is outside the disc. Now I am outside the disc. I will inject the dye for giving transformed epidural through Campbell's triangle. So continuous. Yeah, you can see. Okay, fine. So stop. In the dye, we'll see how the split in the anterior space. Now make it an AP. Now continuous curve. Yeah, you can see how the dye is spreading and coming out through the nerve. That is the transformal epidural through Campbell's triangle.